This is a NCLEX practice test for pharmacological and parenteral therapies. The practice test consists of 40 questions that cover a variety of topics related to medications and their administration. This practice test will help you become familiar with the types of questions you can expect to see on the actual NCLEX exam. Let's get started. 1. 1 tablespoon of medication is equal to how many milliliters of fluid? A. 5 milliliters. B. 15 milliliters. C. 30 milliliters. D. 60 milliliters. Correct answer, B. 15 milliliters. 1 tablespoon of fluid is equal to 15 milliliters. Some nurses may assist clients with measuring medications while in the home environment. There are also some over-the-counter products that list servings in tablespoons, and the nurse should know how to convert these household systems into metric systems. 2. Which of the following must the nurse consider before administering medications through a nasogastric tube? A. The nurse must determine whether a tablet can be crushed. B. The nurse must use 5 cubic centimeters of cold water to instill the medication. C. The nurse must aspirate from the tube after giving the medication. D. The nurse must immediately reconnect low intermittent suction after the medication. Correct answer, A. The nurse must determine whether a tablet can be crushed. When giving medications through a nasogastric tube, the size of the tube limits the type of medications that can be instilled. If a tablet is ordered for a client, the nurse must check to ensure that the tablet can be crushed and then mixed with warm water. Enteric-coated medications and those that are extended release may not be crushed to use through a nasogastric tube. 3. What gauge of needle is most appropriate when giving an adult a subcutaneous injection? A. 16 gauge. B. 18 gauge. C. 24 gauge. D. 30 gauge. Correct answer, C. 24 gauge. When administering a subcutaneous injection to an adult, the nurse should use a fine gauge needle that is large enough to provide the medication and reach the subcutaneous fat. However, because the needle will only reach the fat and does not need to inject through muscle, a large bore needle is also not appropriate. An appropriate size for an adult client is between number 24 and number 26 gauge of needle. 4. Which is the most appropriate muscle site for an intramuscular injection for a 9-month-old child? A. Deltoid. B. Ventrogluteal. C. Dorsogluteal. D. Vastus lateralis. Correct answer, D. Vastus lateralis. The vastus lateralis is the site of choice for administering intramuscular medications to babies and young children. This muscle is developed enough even in young children that an injection in this location is ideal. The vastus lateralis muscle is located on the anterior and lateral portion of the thigh. 5. A nurse is caring for a client who is breastfeeding her baby. Which of the following medications can the nurse administer to this client? A. Aspirin. B. Lipitor. C. Prednisone. D. Amiodarone. Correct answer, C. Prednisone. Some drugs are not safe for use during breastfeeding, as they may enter the mother's breast milk and transfer to the baby, causing unsafe exposure. There are also some drugs that are not recommended when breastfeeding because they decrease a mother's milk supply. A nurse should read the contraindications associated with any drug before administering it to a mother who is breastfeeding. Some drugs, such as corticosteroids, have been shown to be safe while breastfeeding. 6. A nurse is administering a blood transfusion when the client begins to complain of a headache and difficulty breathing. His blood pressure is 170/110 mmHg. What is the next action of the nurse? A. Administer a sedative and analgesic as directed. B. Assist the client to sit upright and slow the transfusion. C. Check the client's urinary output. D. Assist the client to lie supine in the Trendelenburg position. Correct answer, B. Assist the client to sit upright and slow the transfusion. When administering blood or blood products and the client develops symptoms of fluid overload, the blood may be given faster than the client can tolerate. Signs or symptoms of fluid overload include headache, high blood pressure, cough, dyspnea, or arousal on auscultation. The nurse should assist the client to sit up to facilitate easier work of breathing and slow the transfusion. 7. A nurse is caring for a client who has a triple lumen, peripherally inserted central catheter, PCC, in the right arm. Which of the following is a consideration when working with this type of central line? A. The client should be restricted to showers only, no baths. B. The nurse should flush one of the ports with saline solution every 8 hours. C. The nurse should avoid taking a blood pressure in the right arm. D. The client should avoid exercise until the PACC has been removed. Correct answer: C. The nurse should avoid taking a blood pressure in the right arm. When caring for a client who has a peripherally inserted central catheter, PICC, the nurse must refrain from taking a blood pressure in the affected arm. If necessary, the nurse may need to post signs in the client's room for other personnel to avoid procedures in the affected arm. 8. A nurse is caring for a client who has low blood pressure. The physician has ordered dopamine 2 micrograms per kilogram per minute on a continuous infusion. The nurse notes that the client weighs 186 pounds. What is the appropriate rate for this infusion? A. 168 micrograms per minute. B. 372 micrograms per minute. C. 168 milligrams per minute. D. 372 milligrams per minute. Correct answer: A. 168 micrograms per minute. When administering medications that require dosage calculation based on kilograms, the nurse may need to convert the client's weight in pounds. In this example, the client's weight is 186 pounds, which is approximately 84 kilograms. This weight, multiplied by 2 micrograms mcg of dopamine, is equal to 168 micrograms administered per minute. 9. A nurse needs to administer 15 units of regular insulin and 20 units of NPH subcutaneously to a client with diabetes. In what order does the nurse draw these medications? A. Draw 20 units of NPH, then 15 units of regular, in the same syringe. B. Draw 15 units of regular, then 20 units of NPH, in the same syringe. C. Draw 15 units of regular, then 20 units of NPH, in different syringes. D. Draw 5 units of regular, then 20 units of NPH, then 10 more units of regular, in different syringes. Correct answer: B. Draw 15 units of regular, then 20 units of NPH, in the same syringe. When administering 2 different types of insulin subcutaneously, the nurse may draw both NPH and regular insulin in the same vial as long as they are drawn in the correct order. The nurse should draw regular insulin first, followed by NPH, because NPH contains protein that should not contaminate the regular insulin vial. 10. When preparing to give a client a narcotic analgesic, which of the following information should the nurse provide as part of education? A. Take the medication on an empty stomach. B. Lie down for 1 hour after taking the medication. C. The medication may cause constipation. D. The medication may cause heartburn. Correct answer: C. The medication may cause constipation. Narcotic analgesics may cause constipation in some clients. Before administration, the nurse should assess the client's bowel sounds and review his bowel habits. The nurse should provide information about how to prevent constipation for the client and to make him aware that this is a common side effect. 11. A nurse is caring for a client who is recovering from surgery. He is complaining of pain rated at a 9 on a 0 to 10 scale. The nurse administers 2 mg morphine sulfate for pain control. After the medication, the client falls asleep, his blood pressure is 95/48, and his heart rate is 62 bpm. After 10 minutes, the client awakens and asks for more pain medicine, rating his pain at an 8. What is the most appropriate action of the nurse? A. Administer 2 mg of morphine sulfate. B. Check the medication record for a non-narcotic analgesic. C. Tell the client that he cannot have any more medication. D. Contact the physician about the client's vital signs. Correct answer: B. Check the medication record for a non-narcotic analgesic. Narcotic analgesics may have negative effects for a client, such as a decrease in vital signs and increased somnolence. Although the client is complaining of pain, too many narcotics can be detrimental. The nurse should determine if there is another alternative to narcotics to help this client control his pain. 12. After administering a drug, the time when the body first starts to respond to the medication is called A. Plateau. B. Peak plasma level. C. Onset of action. D. Drug half-life. Correct answer: C. Onset of action. The onset of action is the time after a drug administration in which the body initially responds to the medication. Some drugs may have a rapid onset of action but a short half-life, while others may have a slower onset, but their effects last longer. 13. Which of the following abbreviations is acceptable to use as part of medication documentation? A. QOD. B. MS. C. IU. D. PRN. Correct answer: D. PRN. Writing PRN after a medication dose indicates that a medication may be given on an as-needed basis. This requires the nurse to use her judgment when administering medications. There may also be a maximum amount that can be given. There have been many abbreviations that are listed as unacceptable, as they may cause confusion and should instead be written out. 14. How many milliliters are equal to 1 quart of fluid? A. 250 milliliters. B. 500 milliliters. C. 1000 milliliters. D. 2000 milliliters. Correct answer: C. 1000 milliliters. 1 quart of fluid is equal to 1000 milliliters. The nurse should be aware of fluid volumes when administering intravenous fluids and medications. In some situations, the apothecary system of 1 quart must be converted to milliliters. 15. A nurse receives an order for ionsoprazole, Prevacid, 15 mg daily. The medication is available in syrup form of 5 mg per milliliter. How many milliliters must this nurse give? A. 5 milliliters. B. 1 milliliter. C. 3 milliliters. D. 15 milliliters. Correct answer: C. 3 milliliters. When calculating drug dosages, the nurse must determine how many milligrams are available per milliliter and multiply to reach the correct dose. In this example, 5 milligrams of Prevacid is available in 1 milliliter of fluid. Multiplying 5 milligrams x 3 milliliters equals 15 milligrams. 16. A nurse asks her coworker to administer Mr. J's 12 p.m. medication because she is running behind. Which of the following information must the nurse verify with Mr. J before giving him his medication? A. His name and address. B. His name and hospital identification number. C. His name and room number. D. His name and diagnosis. Correct answer: B. His name and hospital identification number. To avoid mistakes in medication administration, the nurse should verify the client's name and hospital identification number before giving a drug. This information is usually available on a client's identification band when in the hospital. Verification should be done on all clients but is especially important in those situations when the client is previously unknown to the nurse. 17. Which of the following is more likely to occur with aging as a complication of medication administration? A. Increased renal function. B. Increased gastrointestinal absorption. C. Increased visual acuity. D. Increased ratio of fat compared to lean body mass. Correct answer: D. Increased ratio of fat compared to lean body mass. Aging adults develop an increased ratio of fat to lean body mass, which affects how their bodies process medications. Increased fat tissues may cause the body to retain fat-soluble medications, which in turn places the older adult at risk of drug toxicity. 18. Which of the following interventions should the nurse consider when giving an oral medication to a child? A. Mix the medication with milk to mask the taste. B. Dilute the medication in a glass of water. C. Refeed the medication if the child pushes it out with his tongue. D. Mix the medication in a food the child enjoys. Correct answer: C. Refeed the medication if the child pushes it out with his tongue. When administering oral medications to a child, he may not want to cooperate with taking the medicine, particularly if the flavor is unpleasant. Small children who push medication back using their tongues can be refed the medication as long as it stays on or near the spoon or cup. Avoid mixing medications with a child's favorite foods, as unpleasant medications may create a negative association with the food. 19. Which of the following methods best describes administration of an intradermal injection? A. Pull the skin taut and insert the needle bevel up just slightly under the skin. Inject medication to create a wheal. B. Pull the skin taut and insert the needle bevel down just slightly under the skin. Inject medication to create a wheal. C. Pinch the skin and insert the needle bevel down into the skin fold to create a wheal. D. Pinch the skin and insert the needle bevel up at a 45-degree angle into the skin. Correct answer: A. Pull the skin taut and insert the needle bevel up just slightly under the skin. Inject medication to create a wheal. When administering an intradermal medication, the nurse uses a fine-gauge needle and inserts it, bevel up, into the dermis layer of the skin. The nurse should pull the skin taut before injection to facilitate easy needle entry. Producing a wheal verifies that the medication is in the dermis and not the subcutaneous fat. 20. Which of the following is a disadvantage of administering intravenous medications through the four-push method? A. It is impossible to determine the full effect of the drug on the client. B. The drug may be irritating to the client's veins. C. The peak onset of action is slower when a drug is given four-push. D. None of the above. Correct answer: B. The drug may be irritating to the client's veins. A disadvantage of giving medications through four-push is that the medicine quickly enters the bloodstream and may be irritating to the client's veins. The nurse must be aware of the effects of the medication on the client's circulation as well as the medication's purposes. Once a drug has been given four-push, it cannot be taken back, so the nurse must always remain aware of what and how much she is giving. 21. A nurse is preparing to administer an ophthalmic medication to Mrs. W. Which of the following statements demonstrates that the nurse is performing this procedure correctly? A. Open your eyes wide and look toward the floor. B. I will hold your eyelashes to keep your eye open. C. I'm going to give this drop in the lower part of your eye. D. Try to keep your eyes open after I give this medicine. Correct answer: C. I'm going to give this drop in the lower part of your eye. A nurse who is administering ophthalmic medications should instruct the client to look up while she holds the eye open by pulling the lower eyelid down toward the cheekbone. The medication should be instilled into the lower conjunctiva and the client instructed to close her eyes just following the drops to distribute the medication. 22. Which of the following effects does obesity have on drug distribution? A. Drugs are distributed more quickly in obese persons because blood flow is increased through fat tissue. B. Drugs are distributed more slowly in obese persons because blood flow is decreased through fat tissue. C. Obesity has a paradoxical effect on drug distribution in that blood flow is decreased but distribution is increased. D. Obesity has no effect on drug distribution. Correct answer: B. Drugs are distributed more slowly in obese persons because blood flow is decreased through fat tissue. Obese persons may have slower levels of drug distribution after taking medications. Blood travels more slowly through fat tissues, and increased amounts of fatty tissues further hampers the distribution of the drug throughout the body. The obese person may have to wait a greater amount of time after taking a drug for it to be released. 23. Which of the following is a potential side effect of ibuprofen? A. Headache. B. Urinary retention. C. Hematuria. D. Low blood pressure. Correct answer, C. Hematuria. Hematuria may be a side effect of ibuprofen. This type of drug is a non-steroidal anti-inflammatory drug, NSAID, which may be more likely to cause small amounts of bleeding. Nurses should consider clients' urinary output, as well as monitor liver enzymes and gastrointestinal function before administering ibuprofen. 24. Mr. B is recovering from anesthesia after surgery. During the case, he was given opioid analgesics, but now his respiratory rate is only 8 respirations per minute. Which of the following medications may be most appropriate at this time? A. Amobarbital. B. Flurazepam. C. Phenytoin. D. Naloxone hydrochloride. Correct answer, D. Naloxone hydrochloride. Naloxone hydrochloride, Narcan, may be used in cases of respiratory depression related to opioid analgesics. Narcan binds to opioid receptor sites in the body, minimizing or reversing the effects of these analgesics. 25. Which of the following is an adverse effect of diuretics? A. Hypokalemia. B. High blood pressure. C. Decreased BUN. D. Anxiety. Correct answer, A. Hypokalemia. Diuretics decrease blood volume by blocking the body's ability to reabsorb sodium in the kidneys. Increased water is excreted during this process, causing increased urinary output and changes in electrolyte levels. Potassium is an electrolyte that can be affected by diuretics, causing low levels, or hypokalemia. 26. Mr. R is being seen in his physician's office for swollen and painful joints. The most obvious joint affected is his great toe, which has become large, red, and painful. Which of the following medications is most appropriate for this condition? A. Docusate sodium. B. Bismuth subsalicylate. C. Allopurinol. D. Cromolyn sodium. Correct answer, C. Allopurinol. Allopurinol is a medication often used in the treatment of gout. Gout occurs with a buildup of uric acid crystals in the body, which collect in the joints, causing warmth, redness, and tenderness. Gout often affects the great toe as a main source of uric acid collection. Allopurinol works by inhibiting production of uric acid. 27. Which of the following interventions reduces the risk of infection when administering an intramuscular injection? A. Draw up the solution approximately 5 minutes before administration. B. Keep the tip of the needle covered until administration. C. Clean the skin with an antiseptic swab in a ½ inch radius. D. Check the client's temperature immediately after administering the injection. Correct answer, B. Keep the tip of the needle covered until administration. A nurse places a client at risk of infection when administering intramuscular injections because of a break in the skin. The nurse can reduce this risk by keeping the needle of the syringe covered after drawing up the solution until she is ready to administer the drug. This reduces the risk of needle contamination that would introduce pathogens into the client's body. 28. A nurse is attempting to start an IV in a client's arm and is having difficulty with finding a vein to use. The client's skin is cold. Which intervention of the nurse may improve the situation? A. Raise the client's hand so that it remains at a level above the heart. B. Place a warm pack on the client's arm for 5 minutes before looking for a vein. C. Instruct the client to drink a quart of warm water. D. Apply a tourniquet 12 inches above the foresight. Correct answer, B. Place a warm pack on the client's arm for 5 minutes before looking for a vein. Cold skin may cause sluggish circulation and increased difficulty with starting N4. A nurse can apply a warm pack to the area where she plans to insert the catheter, leaving it in place for approximately 5 minutes. This action will warm the skin and surrounding tissues and increase blood flow to the site. 29. A client is being admitted on a routine basis for fluids to correct an electrolyte balance. Which of the following sites is most appropriate for starting N4 in this client? A. A vein in the antecubital fossa. B. A vein in the dominant hand. C. A vein in the foot. D. A vein in the non-dominant hand. Correct answer, D. A vein in the non-dominant hand. If a nurse has a choice of sites in which to start N4 and the situation is not an emergency, she should try to start a line in the client's non-dominant hand. This frees the client to use his dominant hand while receiving fluids at the same time. Hands are the most frequent site of insertion, as well as the most convenient. Many emergency situations necessitate the use of the vein in the antecubital fossa. 30. Which of the following interventions best helps to facilitate insertion of an intravenous catheter? A. Ask the client to look away during the procedure. B. Puncture the skin at a 5 to 10 degree angle. C. Advance the catheter until resistance is met. D. Secure the device at a 45-degree angle to the skin. Correct answer, C. Advance the catheter until resistance is met. The nurse can have greater success with starting N4 by following a few protocols that will facilitate easier insertion. The client should be aware that the nurse is starting N4. Once the catheter is inserted, the nurse should advance it until a small amount of resistance is met. This indicates the catheter has reached the vein. By lowering the needle slightly, the nurse can then enter the vein, which should provide a flashback of blood in the catheter. 31. A client with N4 is complaining of pain at the insertion site. There is a bruise at the site, the skin is tender, and the fluid will not flow. Which of the following conditions is the most likely cause of these symptoms? A. Hematoma. B. Phlebitis. C. Extravasation. D. Venous spasm. Correct answer, A. Hematoma. A hematoma may occur at N4 site when blood leaks from the vessel into the surrounding space. A hematoma may feel painful and the area may be tender. A bruise may also develop at the site if blood collects in the tissue under the skin. 32. Which of the following solutions is compatible with administration of packed red blood cells? A. Lactated ringers. B. 0.9% normal saline. C. D5 1/2 normal saline. D. Ormesol R. Correct answer, B. 0.9% normal saline. During blood administration, the only acceptable solution that is compatible is 0.9% normal saline. This is an isotonic solution that maintains the balance of fluid moving into and out of the cells. Other products may have additives that can cause the blood to form small clots in the solution. 33. Which of the following is an example of a colloid solution? A. 5% dextrose in water, D5W. B. Albumin. C. Lactated ringers. D. Normal saline. Correct answer, B. Albumin. Colloid solutions are those that have large enough particles that they do not cross cell membranes from the bloodstream. Instead, colloids often remain in the bloodstream, which is why they might be used as volume expanders in some clients, such as those with low blood pressure due to low blood volume. An example of a colloid is albumin. 34. A nurse is preparing to administer packed red cells for Mr. H when she realizes that he does not have N4. What is the minimum size of catheter the nurse must use in this situation? A. 30 gauge. B. 28 gauge. C. 24 gauge. D. 20 gauge. Correct answer, D. 20 gauge. When administering packed red blood cells, the nurse should give the infusion through an N4 that is large enough to permit the flow of cells into the client's body. Small-bore 4 catheters may not be large enough to accommodate the size of red blood cells. When given a choice of 4 to use for packed cell administration, the nurse should choose an N4 that is size number 20 gauge or larger. 35. A nurse is caring for a client who has been ordered to receive a rapid infusion of packed cells to support his intravascular blood volume. She starts to administer the blood at a fast drip rate and realizes that the blood is not infusing. Which of the following actions may the nurse perform to correct this situation? A. Raise the client's arm above his head. B. Place the client in the Trendelenburg position. C. Place a pressure bag around the blood container. D. Start a new N4 and simultaneously administer a second unit of blood. Correct answer: C. Place a pressure bag around the blood container. A pressure bag is a device used for intravenous fluids that increases the rate of administration. A pressure bag is placed around the bag of fluid or blood and is connected to a small hand pump, similar to that of a sphygmomanometer. The nurse inflates the pump, which causes the pressure bag to squeeze the fluid bag. This squeezing action creates the pressure needed to propel fluid through the tubing and into the client at a faster rate. 36. Which of the following actions is part of preparation of a medication from an ampoule? A. Snap the neck of the ampoule toward the body. B. Hold the ampoule upside down when drawing up the medication. C. Expel excess air bubbles back into the ampoule. D. Always use the same needle for drawing as the one used for the injection. Correct answer: B. Hold the ampoule upside down when drawing up the medication. Ampoules are glass vials that contain medication for intramuscular or intravenous use. Because of their composition, ampoules should be handled carefully. The nurse should cover the neck of the ampoule with an alcohol wipe and snap it open in a direction away from the body. Holding the vial upside down, the nurse draws up the formula, using a different needle than the one that will be used for injection of the medication to the client. 37. A nurse is preparing to add a medication to an N4 that is already infused for a client. Which of the following practices is most appropriate for this process? A. Draw the medication to be added from a vial using sterile technique. B. Inject the solution through the air vent port of the N4 bag. C. Shake the bag vigorously after the medication has been added. D. Clamp the N4 tubing for 30 minutes after adding the medication. Correct answer: A. Draw the medication to be added from a vial using sterile technique. In some situations, a nurse must add medication to an existing bag of N4 fluid without changing the bag. The nurse can add to the bag by initially drawing up the medication to be added using a sterile technique. Because the medication will be added to a solution that will enter the client's body, using sterile technique prevents infection when mixing medication with fluid. 38. Which of the following information should the nurse tell a client who needs to use a metered dose inhaler? A. Shake the inhaler after using. B. Place the mouthpiece in the mouth before compressing the inhaler. C. Take a breath and hold it before compressing the inhaler. D. Immediately repeat the next compression if more than one puff is ordered. Correct answer: B. Place the mouthpiece in the mouth before compressing the inhaler. A metered dose inhaler contains medication to assist some clients with breathing, such as those who have asthma or chronic obstructive pulmonary disease. Although the inhaler contains a set amount of medication to administer when compressed, some clients have difficulties coordinating use of the inhaler with breathing. One method of assisting the client is to teach him to place the mouthpiece in the mouth before compressing the inhaler. 39. Which of these clients is the best candidate for using patient-controlled analgesia? A. An 86-year-old man in the memory disorders unit. B. A 6-year-old boy with a tibia fibula fracture. C. A 56-year-old man post-op day number 1 after a hernia repair. D. A 70-year-old woman with end-stage brain cancer. Correct answer: C. A 56-year-old man post-op day number 1 after a hernia repair. Patient-controlled analgesia, PCA, is a method of pain control that gives the client more freedom with managing his own pain. He can self-administer pain medications without waiting to ask the nurse. Some clients, however, are not good candidates for PCA in that they may not understand how to self-regulate their pain control, or they may not remember to push the button. Those with memory disorders, those in the late stages of terminal illness who may have disorientation, and children are not good candidates for PCA. 40. Which of the following clients is most likely to benefit from receiving a peripheral nerve block? A. A client undergoing a cesarean section. B. A client undergoing an appendectomy. C. A client undergoing a cervical discectomy. D. A client undergoing a total knee replacement. Correct answer, D. A client undergoing a total knee replacement. A peripheral nerve block is a type of anesthetic that involves blocking the sensation of a particular nerve in the arm or leg. This type of anesthesia is useful for clients who are undergoing a procedure that affects only one body part. Clients may or may not need general anesthesia with this procedure, but it offers pain control and diminished sensation to the affected area. An example of a procedure that uses a peripheral nerve block is a total knee replacement. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.